Welcome to the Deep Dive. We take your sources, find the key insights, and get you informed fast. Today, we're diving into a report that starts with a really chilling quote from someone inside. You feel like your life is over.
It's a stark title, isn't it? Really pulls you into the human side of this. We're unpacking a major Human Rights Watch report from July 2025. It goes deep into abusive practices at four Florida immigration detention centers since January 2025.
Right. So our mission today is to, walk you through what the report found. We want to understand the conditions they're describing, the policies behind it all, and what the authors are actually calling for. We'll pull out the big takeaways, maybe some surprising details, and really try to get at the why. Why is this happening?
And just so you know where this is coming from, the report itself is a team effort. Human Rights Watch, Americans for Immigrant Justice, and Sanctuary of the South. And their research sounds pretty thorough, based on interviews, 11 people currently or recently detained, family members of 7 others, 14 immigration lawyers, plus data analysis. So this isn't just theory. It's grounded in actual experiences.
Yeah, that's important context. And they did try to get the other side.
Right.
Human Rights Watch reached out to the facilities, the authority.
They did, but responses were, let's say, limited. One company basically said they cannot comment publicly on the specifics of our engagement. So
Yeah. Okay, so we've got the background. Let's start with the bigger picture. This escalating situation with immigration detention in Florida. The report points to a really dramatic surge, right, since January 2025, and it links it specifically to Executive Order 14159.
That's the one. It mandates detention for anyone suspected of immigration violations, basically throughout their whole removal process. And the numbers, well, they speak for themselves. Nationally, the daily detention population shot up over 40% in just 1 year, June 24 to June 25. Over 56,000 people. That's the highest it's ever been in U.S. history.
56,000, wow.
And here's something that really stands out. Nearly 72% of those people had no criminal history. 72%.
No criminal record.
Nope. So this surge, it's not primarily driven by border arrests. It's mostly ICE arrests within the country. That really changes the narrative, doesn't it?
It absolutely does. That 72% figure is quite something. Challenges a lot of assumptions. So how does Florida specifically fit into this national trend?
Florida's numbers are even more dramatic. By June 20th, 2025, detention numbers there were up 111% compared to before the inauguration. Chrome North Service Processing Center, Chrome, saw a 249% jump by March 25. At points, it was holding like 3 times its official capacity.
3 times capacity.
Yeah. And even the Federal Detention Center, FDC, it hadn't held immigration detainees for a whole year before February 25. By March, it was holding hundreds, just packed.
So these are huge, rapid increases. What are the specific policies driving this in Florida? You mentioned the executive order, but what else?
Well, there are a few key things layered on top. First, there's this national law, the Lake and Riley Act. It mandates detention for undocumented immigrants charged with a whole range of crimes. And importantly, that includes nonviolent stuff, like shoplifting.
So even minor charges mean mandatory detention.
Pretty much. And it even lets states sue the federal government for as little as $100 in financial harm if they don't comply. So, really pushes detention.
It definitely widens the net significantly. What else is feeding into this, maybe affecting people who've been here longer?
Right. That's another big piece. There's a rollback of humanitarian protections happening. The administration is pushing again to end temporary protected status, TPS, and humanitarian parole for people from places like Venezuela, Haiti, Nicaragua, Cuba.
Oh, wow. A lot of those communities are concentrated in Florida, aren't they?
Huge concentration. We're talking nearly 1 million people potentially affected nationwide. Imagine you've had protected status for years, built a life, and suddenly you're facing deportation. The uncertainty must be crushing.
Absolutely. And is local law enforcement getting more involved too?
Very much so in Florida. It has the highest proportion of local police agencies, over 76%, with these things called 287G agreements. These basically deputize local cops to act as immigration agents. They can ask about status, make immigration arrests.
So what does that do to community trust if your local police are also immigration enforcement?
Well, it creates a chill, right? People become scared to report crimes, scared to interact with police at all. It can actually make communities less safe.
And I remember reading about a Florida state law, SB 1718, that affects healthcare.
Exactly. That's a 2023 state law. It forces hospitals to ask patients about their immigration status. The report says 66% of non-U.S. citizens are now hesitant to even seek healthcare because of it.
66%. That's huge. What are the consequences?
Massive public health implications. One doctor in Miami mentioned patients just not showing up for appointments. Some doctors were even thinking about prescribing like 3 months of meds at once so people wouldn't have to come back as often.
Just avoiding the system entirely. That's alarming. And one more thing,
The sensitive locations memo being rescinded, what was that about?
Yeah, that was a big deal. The old policy basically said ICE shouldn't conduct enforcement actions at places like schools, hospitals, churches, sensitive places.
Safe zones, essentially.
Kind of,
Right.
but now that protection is gone, so those places aren't safe havens anymore. It just adds to this deep climate of fear. One activist described cars just sitting, covered in dust outside ICE offices because people went in for routine appointments and just never came back out.
Went in and didn't come out. That paints a picture. Okay, so we've got the policies, the numbers, this whole context of fear and increased enforcement. Now let's go inside the walls, based on what the report says. It starts with this really grim description of initial intake at Chrome. They call it the icebox.
Yeah, the icebox or the hell air. And even getting there sounds awful. People talked about being shackled for hours on these long bus trips, stopping multiple times, sometimes forced to sleep on the bus, no food, no water, toilets not working. One guy described a bus trip where, the smell became unbearable because the toilet was full and wouldn't flush. Another person spent almost a full 24 hours just sitting on a bus parked outside Chrome, still no food, no water, no bathroom access, before they even got processed.
And then inside these icebox cells, what were the conditions?
Freezing. That's the main thing everyone described, like air conditioning to 500 miles an hour, one person said. Josue Aguilar Valle said he was afraid of getting hypothermia, and they weren't given blankets. People slept on the cold floor or hard benches, using their shoes for pillows.
Shoes for pillows.
And just packed in. People held for up to 12 days like this. Rooms meant for 6 people holding 30 or 40. Rooms designed for 25 holding 80.
80 people in a room for 25. How is that even possible?
It's hard to imagine. Jammed in, the report says. There were apparently TikTok videos back in March 2025 that got taken down, but they reportedly showed at least 25 men trying to sleep under bright lights, using clothes to cover their eyes, a wheelchair just stuck in the middle of it all.
Just inhumane levels of crowding. What about basic hygiene and privacy?
Pretty much non-existent in these intake cells. No showers, single toilets out in the open, often filthy. Rosa said she begged officers for cleaning supplies. They just sarcastically told her housekeeping will come soon. Nobody ever came.
That's just degrading.
And think about women. Andrea was held in what was supposed to be a male-only facility. Men could see into her cell, see the exposed toilet. She called it humiliating.
Understandably. And were people able to contact family or lawyers?
Very little access. Extremely limited. Harpinder Chauhan said he was explicitly told not to talk about the conditions on his calls, and he had to make calls on speakerphone with an officer right there.
No privacy at all.
None. And Maxim Cherniak, he was pressured into signing deportation papers without a translator, didn't even know what he was signing. People reported officers telling them they'd be deported no matter what, just fostering hopelessness.
So this horrific intake process, did things get better once they moved into the general housing units? Or did the overcrowding persist?
The overcrowding was definitely still a major problem. At Chrome, cells designed for 66 people were holding 140, 155 men, mattresses just crammed everywhere. People couldn't even walk without stepping over someone sleeping on the floor.
They even put up a tent.
Yeah, a huge tent structure, 26,000 square feet. Right on Chrome's sports field, you can apparently see it on satellite images, just to house more people. And basic needs were still an issue. One man said he went 20 days straight without soap or even water to wash his hands. People made makeshift beds out of styrofoam food trays.
Styrofoam trays.
At FDC, a man in a wheelchair was assigned a top bunk. He asked for a lower one, obviously, but they didn't move him.
It's hard to fathom. This leads us to maybe the most disturbing part of the report, the denial of medical and mental health care. A real health crisis.
Yeah, this section it's tough. IC claims they provide comprehensive medical care, but the report details just life-threatening delays and outright denial of care. At Chrome, for example, only 5 people from each cell could even request a medical appointment each day. Just 5.
So even asking for help was restricted.
Severely.
Yeah.
And women like Andrea and Rosa denied their medication at Chrome because it was technically a male-only facility. Regardless of their health needs, there was a woman with diabetes hospitalized after being denied insulin. Another with gallstones, she lost consciousness, needed emergency surgery, then was sent back to her cell without the pain medication she was prescribed.
This is medical neglect on a shocking scale.
It gets worse. Josue, who had documented HIV, denied his medication for 13 days. His viral load, which had been undetectable, became detectable again. That's incredibly dangerous for his health.
13 days without HIV meds.
And Harpinder Chauhan, the man with diabetes, pancreatitis, heart problems, denied insulin for almost a week. He collapsed, was hospitalized, but they registered him under a fake name, Hank Campbell.
A fake name. Why?
The report doesn't say why, but it meant his son couldn't get any information about his condition when he called the hospital. Just total confusion and panic for the family. There was even an officer who told a cancer patient who needed a special diet, "I know more than your doctor does." Just dismissing medical needs entirely.
The callousness is breathtaking. And this level of neglect, it had fatal consequences, didn't it?
Tragically, yes. The report explicitly links this substandard care to at least 2 deaths in Florida. Maxim Chernyak, the 44-year-old Ukrainian man we mentioned earlier, he developed a fever, chest pain, high blood pressure at Chrome. He asked to see a doctor for days, was denied, just given Tylenol. When he finally collapsed, vomiting blood, officers accused him of using drugs. He died 2 days later.
They accused him of drug use.
That's what the report says. And then there's Marie-Ange Blaise, a 44-year-old Haitian woman at the Broward Transitional Center, BTC. She collapsed. Her cellmate, Rosa, described guards just ignoring their screams for help for a significant amount of time. Marie-Ange died. And afterwards, staff apparently warned the other women in the cell to start making comments about what happened.
Silencing witnesses after a death, that's incredibly disturbing. What about mental health care? Was that any better?
No, it seems just as punitive, unfortunately. If people asked for psychological help, they were often punished or put in solitary confinement. Rosa put it plainly. If you ask for help, they isolate you. If you cry, they might take you away for 2 weeks.
So asking for mental health support gets you punished.
That's what detainees reported. Pedro saw his cellmate, who was self-harming, denied any support. Instead, they put him in solitary for a week. No medical attention. It actively discourages anyone from seeking help.
It creates a cycle of despair. Beyond the medical crisis, the report also talks about food and just degrading treatment.
Yeah, food quality apparently took a nosedive after January 2025. Meals became erratic, lunch served at 6 p.m., dinner at 10 p.m. in smaller portions. At FDC, the food was described as nearly inedible. Sometimes meat was still frozen.
Just basic sustenance wasn't adequate. And then there were these incidents of deliberate humiliation.
There's one particularly awful story. During a transfer, men were shackled, hands tied behind their backs. They were forced to eat their meals off chairs, using only their mouths.
Like animals?
Like dogs, is a quote used in the report. Forcing people to eat like that. It's pure dehumanization, hard to even process.
It really is.
Several incidents are documented. There was one at FDC, April 15th, 2025. Detainees were protesting lack of food, water, medical care. A disturbance control team came in. Shields, pellet guns, stun grenades, smoke grenades, the whole thing.
For a protest about basic needs.
Seems so. They stormed the cell, used stun grenades, forced everyone face down, zip-tied their hands. An officer actually ordered the camera feed to be turned off during it.
Turned off the camera. That sounds deliberate.
It certainly raises questions. One detainee got his finger broken in that incident, and they were held overnight, no food, no water after that. Then at Chrome, June 5th, 6th, there was a silent protest. Afterwards, officers started transferring people out. Carlos saw officers literally jump on, beat, hogtie, and drag men out who didn't want to get on the bus. An IC officer apparently said, "It doesn't matter. You need to get on the bus. Just brute force."
And the verbal stuff, the day-to-day harassment.
Constant, according to the report. Officers mocking people, playing vulgar music over the intercoms. One officer kept calling Harpinder Chauhan Chihuahua, just degrading nicknames. Brian, another detainee, was spitting blood at one point, and a doctor reportedly said, "He's not our problem."
Not our problem. Wow.
And these invasive searches, too. Chauhan and Pedro mentioned being subjected to visual cavity searches after arriving at FDC, and even after visits with their lawyers. They later found out those searches weren't actually required for ICE detainees there, just arbitrary humiliation.
Seems like a constant state of powerlessness and degradation. What about lockdowns and just having anything to do?
Frequent long lockdowns, especially at FDC, sometimes almost 4 days straight, often blamed on short staffing. During lockdowns, no access to recreation, sometimes no medical care, stuck in cells or limited areas. It really makes you question how these places are run versus basic human rights.
Absolutely. Operational needs versus human dignity.
And at Chrome, during the worst overcrowding, recreation time was cut to maybe 30 minutes once a week. People had to choose, go outside for half an hour or go to the commissary to buy essentials.
An impossible choice.
Beyond that, almost nothing. No real educational programs, no vocational training, nothing rehabilitative, just warehousing people in grim conditions.
Okay, so we've heard the conditions, the treatment. What's the legal backdrop here? The report is very clear these conditions violate standards. Right?
Extremely clear. It states these conditions flagrantly violate international human rights standards and the United States government's own immigration detention standards. That's strong language. On the international side, we're talking violations of core treaties, the International Covenant on Civil and Political Rights covering basic rights like humane treatment, the Convention Against Torture, which prohibits cruel, inhuman, or degrading treatment, and also the UN's Mandela Rules, which are sort of the global benchmark for treating prisoners humanely, even though they're non-binding. These aren't minor technicalities, they're fundamental principles.
And not just international law, but they're breaking their own rules too.
Yeah.
ICE's standards.
Exactly. The report points out violations of ICE's own guidelines. The PBNDS 2011 standards used at Chrome and BTC, and the NDS 2019 standards for FDC. For instance, PBNDS requires timely medical care, proper hygiene, humane treatment. The report argues none of that was consistently happening, so it's a failure even by their own metrics.
Given this mountain of evidence and these violations, what are Human Rights Watch and the other groups actually calling for? What are the recommendations?
They lay out some significant reforms needed at all levels. First and foremost, a big shift away from detention itself. End the default use of detention. Replace it with community-based case management programs. These alternatives exist, they're often cheaper, and people show up for their hearings. They also say protect vulnerable people. Don't detain asylum seekers, don't detain people with disabilities who clearly can't get the care they need inside.
Makes sense. What about fixing the policies that led to this surge?
Yes, definitely. Reinstate and expand protections. Bring back the sensitive locations memo and make it stronger so people aren't afraid to go to school or the doctor. That directly tackles the climate of fear. And accountability. Terminate those 287G agreements that entangle local police with ICE. Increase independent oversight, real oversight, unannounced inspections. And be transparent about conditions, about deaths in custody.
Transparency and oversight seem crucial.
Absolutely. And finally, just fix the conditions inside. Address the systemic failures in healthcare, hygiene, basic care. Ensure timely, quality medical and mental health services. Provide proper accommodations for disabilities. Train staff in trauma-informed care. And ban prolonged solitary confinement, especially when it's used as punishment.
It's a comprehensive list, tackling the system from multiple angles. So this deep dive really brings us back to that opening quote. You feel like your life is over. It shows how policy decisions enacted quickly can have these devastating immediate human costs. We've seen a system outlined in this report that seems to consistently fall short of its own standards, let alone international ones. As you think about all this, maybe consider, what is the real cost? Not just to the people detained, their families, but what's the cost to us as a society when fear seems to outweigh the pursuit of justice and basic human dignity? Something to reflect.